Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a weekly show where we bring you experts from Apollo hospitals live to this session. And you can ask your questions and queries in case you have one. Please join us on YouTube because if you must be watching this on Instagram or Facebook, you can still watch the content there. But if you have a question to ask, we request you to jump onto the YouTube channel of Apollo 24/7 where you can type in your question in the chat box and I shall place the question before our expert today. And also, it will be helpful if you download Apollo 24/7 app because today I'm going to ask you some quiz. There are going to be a three questions quick quiz session where you can win prizes from Apollo hospitals, and also you can use the discount vouchers and coupons that I'm going to share today towards the end of the show. So these are the standard instructions, and today we're going to talk about a very important topic. We're going to talk about the newborn baby's health guide from everyday wellness to emergency action. If you have a little one who's coming into your family, or if you already have a little one you're taking care of, please come on board. Ask your questions that you have. We understand the anxiety of a new parent, and here we are bringing you a pediatrician live today. Dr. Sangeetha Hariprasath, who's a pediatrician from Apollo Children's Hospital, Greens Road, Chennai. She's going to join us very shortly on the show. Let me introduce Dr. Sangeetha Hariprasath to you with more than experience of 10 years. She works with Apollo Hospitals, Children's Hospital, Greens Road, Chennai as a pediatrician. And she has a lot of memberships, and she's a very well published author, and journals also she's published in. And she can be consulted for the specialized treatment of pediatric emergencies, infectious diseases, immunization of children, allergies, newborn care, growth and development in children, and adolescent health as well. So let me welcome Dr. Sangeetha Hariprasath on the show. Good morning, ma'am.
Good morning, Jhansi. Thank you for the lovely introduction.
Thank you,
So,
ma'am. Thank you
uh,
so much.
so when a newborn baby is being born, we also say, especially for the first-time parents, a new mother is also being born. So, when a baby is
Perfect.
born, baby brings in a lot of joy and happiness, not just to the parents but to the entire family. So, I'm
Exactly.
sure the parents. The mother
Yes.
will be flooded with a lot of information both from her family, outside, social media, everything. So we as I mean, they will be already in so much of stress, anxiety, which to do, what to do, what not to do. So we as
Correct.
pediatricians are always available to them. They can always reach up to us and get their doubts clarified.
So very well put, ma'am. Because anxiety is one, happiness is one. While the child brings a lot of happiness, we keep forgetting that there is also an anxious set of parents and anxious set of family who is looking out for right kind of information. So
Yeah.
now that we have had generations of human species delivering, and then the progeny is continuing, we do have enough hands-on information. Now the medical advancement, the science and technology has advanced so well. So not just leaving the child to grow on their own. We do have set of parameters right from the birth to what age is a child called a newborn, and what are the phases that you want to divide on, and what's the medical help that one has to seek in the phases.
Yeah. So is a baby till 28 days or 1 month. We call it as newborn or neonate, and from
Okay.
then till 1 year of age, we call them as an infant.
In
So
fact.
yeah. So there are a lot of parameters in which the growth of a newborn baby is assessed. So when you are being discharged from the hospital, all the mothers will be given a vaccination card, and along with it, there will be a growth chart attached, wherein the
Hmm.
baby's height, weight, head circumference, and the other indicators will be marked in a chart.
Yeah.
So this is an easily understandable chart with which the parents themselves can understand whether the child is growing in the normal level, the 50th percentile, or is there anything else which can be done. So all the mothers are being given with this chart along with the vaccination schedule once the baby is discharged from hospital.
So I never understood the percentiles that one has to, normal person. So there was a graph which was so beautifully shown later. Can you please
Yes,
explain the
yes.
percentile and the graph and the chart, please?
So we will be having three curves, usually the 25th percentile, 50th percentile, and 75th percentile. So what this is based on 100 children, I mean, in Indian population, what is the average growth? So as long as your child's growth is in between the 50th and, I mean, above the 50th percentile, that means your baby's growth is good, so you don't have to panic much. So only if the I mean the curve comes touches the first line or comes below it, that means you have to contact your pediatricians and get advised on what to do.
Okay.
So
So
each
now
and every
that
visit, sorry.
the growth is a natural phenomena which takes place naturally, but there are so
Yeah,
many questions around the growth, the feed especially. So
yeah.
can we please talk about, can you please give us some insight about how important is the mother's milk, the first feed se lekar to latching on for the first month to the newborn, and what's that phase and why is it so important?
Yeah, we actually we call the first milk which is secreted by a mother as colostrum, which is very rich in nutrition as well as it is high in good immunoglobulins, which protects the child from lot of infections, pneumonia, gut infections. So we also call this as the first vaccine which we give the baby. So
Oh,
it is always good to give the initiate the breastfeed within the 1 hour of birth, provided the baby is stable and there are no complications. So always
oh,
initiate feeds within the first hour. And exclusive breastfeeds till 6 months of age is recommended. So what do you mean by exclusive? Exclusive breastfeed is just breastfeeds without any water, gripe water, or anything. So the only thing which is allowed is medications which are prescribed by your pediatricians. So the usual medications which we prescribe are vitamin D drops. So why we give this vitamin D is the only nutrition which is not being secreted by a mother in her breast milk. So the
oh,
richest source of vitamin D is sunlight. So a newborn baby will not be exposed to much sunlight. And when I say sunlight, it's not just early morning sunlight. It is the harsh afternoon sun which helps your skin to secrete vitamin D. So this is we will not let a baby out at that time. So it is always best to give your baby vitamin D drops till 1 year of age, when the baby has to when the baby starts to crawl or walk for the bone health and development. So it is always important to give vitamin D drops till 1 year of age. And
correct.
till 6 months, it is exclusive. We always advise exclusive breastfeeds. And after 6 months, you can slowly start your child on solids, complementary feeds. So you can consult your pediatrician and you can ask them what is best to be given. Usually, we advise rice, ragi porridge, and slowly you can start introducing mashed food like vegetables, fruits, which are soft mashed foods, and you can slowly add on. So this
Right.
is what. So
Yeah. So while you are talking, I have gone back to my days of nursing and as a first-time mother, the kind of confusion. So I always had it's not just me. I've seen so many mothers around me. That is the baby feeding enough? Am I able to give the child enough feed? How does a mother understand that her breast milk is sufficient for the child?
yeah. So this is one question which we regularly encounter in our office practice. Each mother wants to give the best to their child, so they
Correct.
always have this question in their mind. So you can understand to some extent from the baby's cues when the baby is hungry. So we always advise on demand feeds, especially in the first couple of months. Demand feeds works best. So whenever your baby is hungry, usually once in 3 hours or once in 2 hours is what the baby requires feeds. So you see the baby, there'll be like gentle smacking of lips. The baby will put his hands on his mouth. So from these, you can understand that the baby is hungry and you have to initiate breastfeed. And when you are feeding, it is always best to empty the breast fully in one side before you go to the other breast. Usually, the baby
Mm.
suckles for up to 15 to 20 minutes. So the initial milk which comes is watery, which quenches the baby's thirst. Only after emptying that, the fatty, nutritious milk comes in, and this makes the baby satisfies its hunger. So if you shift to the other breast, the baby would have taken the fore milk, which is watery from both the sides, and it will get hungry frequently. So always empty one breast first, and then move on to the next breast. And how do you know that whether they always, all mothers, they feel that the breast milk is not enough. They say, I always feel my secretion is not enough. So
Yes.
how do you know that the baby is well fed? So after each breastfeed, the baby is usually sleeps for like a half an hour. And if the baby is voiding urine adequately, I mean, minimum of 6 times per day, and if there is an increase in weight, that means your baby is well fed and what you're doing is enough. You're doing the best for your child, so you can just continue what you're doing. You don't need any additional formulas or any. Until 1 year of age, absolutely no cow's milk or buffalo milk. So
Okay.
after 6 months, you can slowly start on the other complementary feeds.
Well, here you did mention about the growth of the child, weight growth of the child.
Yeah,
So, the anxious parents are worried about the growth of the child. There are other parameters that they check. You know, they do have a in South India or North. They do have dhage, the threads that they have around the feet, ankles, and the
yeah,
waist. And is that a
yeah.
good parameter to see if the child is growing, or weight is the only parameter?
Actually, we say a baby doubles its weight by 6 months, and the birth weight, and I mean, becomes 3 times the birth weight by 9 months to 1 year.
Hmm.
So this will give you an idea about the average weight gain which the baby is required. And as I mean, this thread and all this will not give a very clear cut idea about the baby's growth. And many a times we see the babies coming with tight threads over the I mean hip and
Yes, yes,
thing, which might cause frictional ulcers and all that. So
correct, correct.
yeah,
So, so weight is the best parameter according to Dr. Sangeetha. And here's the first question, Mr. Ravi Kakkar, 35-year-old male, who's asking about the child's first vaccines. What are the first vaccines for a infant of 0 to 5 years age?
yeah. So when your baby is born, during the after the initial resuscitation, and the baby will be in the hospital for 1 or 2 days. So before you're being discharged, your baby will be given the zero dose polio vaccine along with the hepatitis B and the BCG vaccine. BCG vaccine will be given in the left forearm, and after which you will notice a small bleb in your forearm, which is absolutely normal, and there might be a little bit of ulceration in that, which is also normal. So after discharge, you will have at around 4, 10, and 14 weeks of age, you will be given your DPT along with IPV and HIB, and also the pneumococcal vaccine, and one more oral rotavirus vaccine. So these are the vaccines which will be given in the 6, 10, and 14 weeks of age. And by 6 months and 7 months, you will be given your flu shots for your baby. And again, in the ninth month, you will be given your MMR vaccine. And by
Hmm.
12 months or 1 year, you will be given your hepatitis A along with your varicella vaccine. And again, in your 15th month, you will be given your MMR varicella vaccine. And from your 16th to 18th month, you will be given all the booster doses of the vaccines which you have given previously. That is DPT,
Hmm.
HIB, IPV, and the pneumonia vaccine. And then by 2 years of age, you will again have your booster for your varicella, and typhoid vaccines also should be given before 2 years of age. And most of the vaccination is complete by 2 years. And again, fifth year, you will have the boosters of DPT, HIB, and IPV. And then later, until 5 years of age, you should be given your annual flu shots. Every year, you will have to keep repeating your flu shots. And then after 10 years of age, you will be given your DT, the tetanus shot. And for girls, we always advise the HPV vaccine, which prevents them from the cervical cancer. So these are the
Wonderful.
vaccines which we give.
So, around the vaccines, there's so much now that we've made that the national vaccine immunization protocol is now publicized so well. Initially,
Yeah.
when it was a choice, the parents were always confused. Now that there is a
Yes.
protocol, mandatory vaccines are being
Yes.
given in the schedule. But still,
Yeah.
parents do have problems and concerns. So, what is the first concern? It's pain, the vaccine site
Yes.
being bruised or redness or tenderness, and three, the
Yeah.
kind of slight feverishness or lethargy or dullness after the vaccination. So, how much
Yeah.
should a parent worry about these, and what are the factors to be kept in mind?
Yeah, so the side effects especially happens during the vaccination, which happen around 6, 10, and 14 weeks of age. So the DPT vaccine which have been given causes slight pain and fever. But now we have an option of painless vaccination. So in this, the side effects will not be that pronounced, and there'll not be any fever. So you can always contact your pediatrician and ask. You can discuss with them what kind of vaccination is comfortable for you, and you can get it done. But the fever will last if, I mean, it's not compulsory that the child will get fever, but even if the fever comes, it will be for less than 24 hours, and you will be also warned about the warning signs, when to reach out, and you'll also be given a paracetamol which can be given if the child is having fever. So
Yeah.
you don't have to panic. The rest of the vaccines, there will not be much side effects. Only this DPT, which is being given in the 6, 10, 14 weeks, and the boosters, you can expect a slight pain and fever.
Yeah, but what is an emergency or a red flag or anything that they have to watch out for? Is there something, a warning sign as such?
Yes. So, in case the child is having high grade prolonged fever or incessant cry, and there's any blank staring look, or the child is not taking feeds properly, then immediately reach out to your pediatricians and they can advise you what to do regarding that.
Great. So here on YouTube, I have a live viewer, Mr. Manikandan Rajamani. 25-year-old female Ananti is asking the question. My baby is 1 month old, and frequently she keeps vomiting. Milk keeps coming out after the feed. Can I know the reason and remedy, please? And what is normal, ma'am, Sangeetha? And what isn't normal? Babies burping
Yeah.
and a little bit of milk, curdled milk
Yes.
coming out. Is that
Yes.
okay?
Yeah, actually, every time you finish breastfeeding your child, we always advise them to burp the child. So take the baby on your shoulder and gently pat it in between your shoulder blades. Usually, the baby burps out. Even if the baby doesn't burp, it's better to have your child upright for 10 minutes post feeding. And once the baby swallows the milk, a little bit of air is also swallowed. So it is natural for the baby to burp out that air, and along with it, a bit of curdled milk, say 1 ml is which comes is normal, very normal. You don't have to panic much. So only if your baby vomits out the entire feed frequently, or this there's a lot of milk coming out, then you can contact a pediatrician. There are very safe medications which the child can be put on for a couple of weeks to stop this. But
Yeah.
baby bringing out a little bit of curdled milk is absolutely normal, and this can be avoided if you properly burp a child after each feed.
Yes. There's this very important factor that burping is something that a father can do, or somebody, a male can, take over that responsibility. And it is
Yes,
so very well done by the new generation fathers. And I see,
I know.
in my friends circle and my group, where proud fathers say, I'm a better burper than the mother. And that's the kind of
Yeah,
change that we're seeing, and how burping
I
has
know.
become a very important technique.
Yeah, it is always a pleasure to watch a father doing all helping out the mother, especially the mother will be really exhausted continuously feeding the child. So it is always so good to see a father pitch in and take care of the baby while the mother takes the rest which she requires.
Yeah, right. So here's next question. Shravani, who's 26-year-old. The baby is 7 months old. She's vomiting frequently. The vomiting is small, less than 1 spoon. Should I get it checked?
I'm sorry, how old is the child?
7 months.
7 months. So, yeah, if it is very frequent, it is always better to get your child checked. But usually, what we are concerned is persistent vomiting. If any surgical issues with the tummy will be associated with persistent vomiting, distension of your stomach, abdominal distension, or any passage of blood in stools, all these are warning signs. But even then, if your child who's 7 months old and is frequently vomiting daily, it is always better to get your child checked by a pediatrician, and you can take some drugs to control the dysmotility. I mean, it is always safe to put them on a medication which can be given before each feed, so that this can be cured.
Wonderful, ma'am. Thank you. Next question is again something related to stomach and stomach ache. Shambaji, 31-year-old male. How do I know if my baby is crying from a stomach ache? You know, babies do cry. Colic is something
Yes,
that bothers them, and we are all, learned behavior कि बच्चा रो रहा है, gripe water दे दो.
I
So
know. I know.
we're in a generations together. We've heard this. And what is a colic
Yeah.
pain? How do we understand and differentiate a colic from a normal crying?
I know. So crying is the only language with which a newborn can communicate to us. So when a baby cries, it is not always hungry. It is not always stomachache. A baby cries when he or she is hungry, when he or she is sleepy or wet, or just needs to be held. So these are all the cues which the baby is giving you. So in case a baby is crying incessantly, try putting her on your shoulder upright, and gently you can sway the child. If the baby settles down, then you don't have to panic. If the baby is crying incessantly or continuously and is not getting settled, then there could be a colic. So you can again consult your pediatrician. There are safe medications to control the baby colic, so that can be given.
Yeah, and what is colic, ma'am? What are the reasons for a colic pain, and how do you understand as a parent? Is there a distension? Is there, is the tummy tight, or do the children
Yeah.
burp?
So colic is again when the stomach is distended with the gas. So when the gas, which I mean the air which the baby swallows, so the stomach is just distended. So there will be a bit distension of stomach, and the baby can stretch out. I mean there'll be some arcing positions. So with this you will know, and usually the baby settles down when baby is put on the shoulder and there's burp. And if it's not getting settled, then you might need to reach out to a pediatrician.
Yes, and the most important question, ma'am, gripe water ka question. And this is now that we don't see the advertisement, but the advertisement is etched in our brain so much कि बच्चा रो रहा है पिला दो. And this has
Yeah,
become
I
one
know.
generations down. And what is your
Yeah.
advice?
No, no gripe water. Absolutely no gripe water. It is not at all required. In fact, earlier days, gripe water used to contain a bit of alcohol, which will sedate the child. But so, absolutely no gripe water. The breastfeeding is enough for the child. Nothing else is required. And if there is a colic, there are medications which can be given to control the colic. No
Okay,
gripe
so do
water.
not trust the sources which are hearsay. Trust your pediatrician who is going to give you a
Yes.
proper medication. Do not buy
Yes.
anything over the counter और किसी ने बताया है इसीलिए बिल्कुल मत खरीदना. So that's
Yes.
one very standard announcement that we will have to make. Well, next question is from, yeah, bathing questions. I think I'll take some the skincare and bathing questions, ma'am. Shreya Gupta, 25-year-old mother. What's the best way to bathe a newborn? What should I do if my baby hates bath?
Yeah, so usually we are the first bath can be given after 24 hours. So why do we suggest that is when the baby is being born, there'll be a cheesy white substance covering the baby, which we call the vernix caseosa. So this contains a good fatty acids which moisturizes the skin. So it is better to postpone the first bath for a minimum of 24 hours, and then you can give bath to the baby regularly. So we don't advise oil massage prior to the bath till the umbilical cord dries, falls. So once the umbilical cord falls, which is usually taking around, I mean, takes about 10 days to 3 weeks. So once the cord falls and that area is dry, you can start giving gentle oil massage, not very vigorous massages, soft, gentle massage with any coconut oil or whatever oil your pediatrician suggests, and then you can give a bath to the child. And after giving bath, immediately you can apply the moisturizer lotion. So why do we ask that is when when the baby's skin is moist from the bath, the moisturizer seals the moisture back to the skin. So there is no use applying moisturizer later when the skin is dry. So immediately apply the moisturizer. And there are a lot of questions about the soaps and shampoos which has to be used.
Yes, that
So
is
for
supposed to be my next question in waiting, is that which are the products that are safe to use? And of course, yes, the kind of tests that do we have to do, a patch test on the child. This commercially, there's so many products available.
yeah,
What's your
yeah.
advice on it?
So, the soap which is safe to be used for a newborn baby is basically soaps. You can just read in the soap. It has to be fragrance free, free from sulfates, parabens, and hypoallergenic. So, what we call a scented soap. So, the pH should almost match a baby's skin. So, this is the kind of soap which we usually recommend, soap or body washes. So, whatever is it. And even shampoos, the shampoos which do not produce a tear actually matches the pH matches with the baby's skin. So that kind of soaps and shampoos can be used. And post that baby's bath, you can apply moisturizer. And before applying, I mean, putting on a diaper, you can always use a diaper rash cream and then put the diaper.
Okay.
And
So now,
please don't
now, sorry, ma'am. Please continue. Please continue, ma'am.
Yeah, there are practices of drying the baby over smoke or sambrani. They'll usually put that. Please don't do that. Gently pat dry your baby with a clean towel and then apply the moisturizer. And you can
Right.
clean the ears and nose with a cotton wick or a cotton towel. No, you don't have to use
Observe.
earbuds for the baby's gentle.
No
Yeah.
earbuds. Yeah. We
Yes.
don't even know how much we're going inside and what kind of harm we do gently.
Yes.
Even if it is gentle, we don't know how gentle it is on the baby. So it's better to
Exactly.
avoid all of that. Yes. Ma'am, while you were talking about the products which are gentle, safe, and pH balance, what if the child still breaks down out into some kind of reaction? What are the signs that I have to watch out for, and what is actually not, or what is actually an irritant to the child's skin?
Okay, so you will notice rashes over the skin, and there'll be, I mean, marks over the skin. So, in case your baby is having a sensitive skin, you can approach your pediatrician. There are a lot of safe options which can be recommended by the pediatrician. So, the soaps which I have mentioned, if it satisfies all this criteria, usually it will be a moisturizing soap and it will be hypoallergenic, so which will be safe for even sensitive babies, sensitive skin
Wonderful.
babies.
Great. So now here's a very important question. Is it safe to put oil in my newborn's ears and navel?
Never, never, please don't do that. So the habit of putting oil in ears and blowing out phlegm from the nose, putting oil in the navel, or putting oil inside the child's mouth, eyes, please refrain from doing all these. And don't
Hmm.
put kajal or anything over inside the baby's eyes. You can put a small dot over the forehead or in the face, but never in the eyes. Don't smear the
Right.
baby with kajal.
Yes. Next question is from Ms. Jaypal Mehta. When do we know that our baby's teeth are about to come, and what are the signs that when we will have to give a medicine in case needed? The first tooth
So
eruption is
you
always a joy to see.
Yes. So usually the eruption begins by around 7 months, but you can wait till 15 months also. There are many
Acha.
parents who are very anxious coming by 1 year of age telling that my baby's teeth has not yet erupted. You can still wait till 15 months. So the teeth, the usually the lower incisors are the first teeth to erupt, and you can see the gums becoming hard and the teeth slowly erupts. So the baby gets, I mean, they have during the teething, they have a tendency to put everything in their mouth. So there are
Yeah.
safe teethers which can be given to the child, but make sure you sterilize them properly. Each time the baby drops them down, you pick it up, sterilize it properly, and you can give it to the child.
Well, I do call, when they say troublesome twos and troublesome terrible threes, I say teething is the most troublesome. When, we
Yeah.
think teething, but I've understood that it's a curiosity of the child to put everything and feel everything through the
Everything.
mouth, in the
Yes,
mouth. And
yes.
the kind of anxiety, I'm trying to recollect the anxiety that I used to have. And I used to really sterilize everything and keep everything safe. Now, ma'am,
Yeah.
is teething in an infant really discomforting? We do associate a lot of our Indian parenting families, we do associate teething with diarrhea. So we miss the connection that we're
So,
putting everything in the mouth. But would you want to explain it
yeah.
further?
So that is exactly what happens. The child has an urge. I mean, there might be mild pain. It usually not be very painful. So there will be a mild pain, and the child has a tendency to take everything and gnaw on everything. So when the child grabs on something which is unsterile and puts in his or her mouth, then they get diarrhea. So that is what the relationship is. Not because the teeth erupts, but when the child grabs and puts something unsterile in the mouth, he or she gets diarrhea. So
Yeah, yeah.
just make sure the
But
child, everything around is sterilized.
yes, ma'am. So now I don't see anybody asking about a question which is about the baby stools. That was always so worrisome, ma'am. I remember the texture, the times, the color, the smell,
Yeah,
everything is really anxious for a new parent. So, what are the
yeah,
signs that a child is having an infectious stool or tummy is into an upset tummy? And what is a normal
yeah.
kind of stool?
So the stool which the newborn baby passes initially is called a meconium. So a meconium will be dark green or brownish in color. So after a while, after a couple of weeks, the stools gets transitioned to become the golden yellow stool, and it is normal to find I mean curly white precipitates, which is milky precipitate. That is absolutely normal. So a newborn baby passes stools maybe 3 to 4 to 5 times a day, which is absolutely normal. And later, after 2 months of age, there are a lot of parents coming and telling me, my baby has not passed stools for 3 days, 4 days. So what should
Yeah,
I do? So in case it is an exclusively breastfed baby whose thyroid level is normal and who don't have any abdominal distension, and he or she, when they are passing the stool, there is no hard form stools. It is absolutely normal for babies who are exclusively breastfed to pass stools once in 5 days also, because the breast milk composition is exactly what the child needs and everything is digested, so there is little to come out. So exclusively breastfed baby can pass stools once in 3 4 days also. So nothing to worry if the baby passes normal stools once in 3 4 days. And then
yeah,
when you slowly start complementary feeds for your baby, the stool will, I mean, the routine will get set. He or she can pass 1 or 2 times per day. And if your child is getting watery stools, more than 4 or 5, I mean, the frequency is increased and the texture is also very watery, or if there is stool with blood mixed, and if there's any abdominal distension associated with it, and along with vomiting, you have to immediately contact your pediatrician.
right. So the dehydration from such diarrhea is more riskier than any kind of other ill health, is
Yes.
what I've heard, ma'am. And how serious is dehydration in a newborn and an infant is important to address.
Yes. So since the babies are small in size and their water composition is also like different from what we see in adults. So if a baby passes large volume watery stools, it might be just 3 or 4 episodes. The baby can quickly go in for dehydration. So how do you assess your child for dehydration? So the indirect way to assess your child for dehydration is to check for the urine output. If the baby is
Acha.
voiding urine adequately and if the color of the urine is normal, it's not very concentrated, very yellow, that means the child has not gone in for dehydration. So if it is less than 6 months, breastfeeding frequently is enough. You don't even have to give, I mean, water. So, and if you feel that the stool frequency is increasing, please consult your pediatrician immediately. And if the child is more than 6 months, you can give home available fluids along with breast milk which are rich in salt, like electrolytes, like tender coconut water, buttermilk, and all that. And then you can contact a pediatrician who can put you on medications.
Great. Thank you so
So,
much for
urine
explaining.
is one way to assess the dehydration.
Yes, ma'am. So here's the next question, which is very important. I'll not take the brand name here, but people do reach out to you, especially the healthcare providers, asking for supplements and formula milk for babies. Here, there's a name which I don't want to take, but I want to know more about the formula milk brand. Is it good for digestion, and how about overall nutrition requirement of a baby? So, what is a formula milk and what is it, who is it for, and who should not be fed with a formula milk?
So, mothers for whom the breast milk supply is quite good, the baby doesn't even require a formula, especially in a baby who's 7 month old. So, even if you feel that your breast milk supply is a little bit low, you can start the baby on other feeds, solids, which will take care of the nutritional requirement. You don't need a formula later. You can just continue breastfeeds. So, breastfeeding till minimum of 2 years is very good for your child. If not for the nutrition, your child will have good immunity, and there are a lot of other benefits of breastfeeding. So, in case you're not able to breastfeed, after 6 months, you can start the child on complementary feeds, and these will be enough. But in case child is less than 6 months, and there are a lot of medical issues which the mothers face, due to which the breast milk supply is low, then you don't have to feel guilty about it. There are like equally good formula feeds which your pediatrician can advise you about, and you can top it up with along your breastfeeds.
So
I
again,
don't want to provide
again
the
underline.
brand.
Yeah, yeah. Again, we are strongly saying that this is only for children whose mother is unable to produce breast milk in sufficient quantities and without guilt. Only on the instructions of a pediatrician, formula milk advice should be procured. That's again highlighted, underlined, bold letters. We're saying this. Yeah.
Yes, true.
Okay, ma'am. Next question that I would want to give is Parvati, who is 22-year-old female. Ma'am, I'm breastfeeding, and what to eat and what to avoid while I'm breastfeeding.
Yeah. So there are food which will increase your breast milk supply, what we call as galactogogues. So all dairy products, including milk, cheese, curd, all this, and along with garlic and the veggies, spinach, nuts. So these are stuff which will increase your breast milk supply. You can have a diet which is rich in protein and plenty of liquids, so that your breast milk will be good. And avoid taking fatty junk food. So you don't have to eat lot of carbohydrates. So you
Yeah.
can eat lot of food rich in protein and fat for the breast milk.
Wonderful suggestion there, ma'am. Because traditionally we are fat produces good milk. Eat that, and thereby instead of giving good quantity or quality of milk, the mother herself is finding herself in obesity, and then trying to lose weight is again a big challenge. So yeah,
I know.
Jaipal ji is asking a question, but can we, Jaipal ji, will you quickly be able to type your child's age and weight so that ma'am will be able to answer the question. He's asking about when do we start cow's milk and vegetables and fruits to the child, but also it will help if you give your child's age.
Yeah, so as I said, cow's milk can be given only after 1 year of age, because the cow's milk protein is a very strong protein, and the baby's gut, which is very soft and friable, will not be able to tolerate this protein. So there are instances of children coming with diarrhea, bloody stools due to cow's milk protein allergy. But you can start your baby on,
Jaipal's child
yeah.
is 7 month old.
Yeah, 7 months. So the milk requirement can be got from breast milk. So you can continue to breastfeed your child, and fruits and vegetables you can start your child once you start solids, that is above 6 months of age. So you can you can give mashed bananas, boiled and mashed carrots, boiled and mashed apples. All this can be given from 6 months of age. Everything is safe. And when you introduce a new food, just make sure you watch for a couple of days and see if the baby is not getting any allergies from it, and then slowly start adding up to it. You can start adding new feeds to it, and you can build on that.
Yes, and the baby, Jaypal Mehtaji's baby is 7 month old, 8 kilos weight, and I think that's a good way to progress. And ma'am, while you're introducing foods, so if you have a problem, you see that there is a problem with one kind of food, what do we do next? Do we stop and then wait for the child to get normal and then introduce another food?
So we can only tell that the baby is allergic to the food if the same reactions happen more than 3 times. So for that time being, you can stop the food and then continue with the what baby is already been getting, and then reintroduce it after a couple of weeks and see. So only if because a lot of people say that my child is allergic to egg and they stop giving egg totally. So egg is a complete protein, and it is very good nutrition. So we usually advise, not people who are okay giving egg to give an egg daily. So you have to keep introducing it, and you can give it 3 times. And if the child is getting reactions or anything to it, you can stop.
Yeah. Now, Vishal Bhayana is asking, child is 1 year old. How do I introduce new foods to my baby's diet? Especially the 1 year old ones are really fussy. And they, you by the time that they understand the family's food patterns, they can be very picky and choosy. And this is the most important time for a child and the parent as well.
Yeah. So when a child is 1 year of age, he or she becomes very playful. So they know it's the taste which matters to them. So you can make the food more colorful, and you can bring in a lot of textures, and you can actively involve the child in preparing the food. So usually we'll ask the parent to introduce all the food before 1 year of age. So before the 1 year of age, you can introduce all the food, and after that, you usually there's a period of negativity. They will not take anything new after 1 year of age. So after 1 year of age, the main concentration will be in playing. So get the child more actively involved. You can make them sit with you when you are eating, so they can see you eat and eat alongside with you.
Yeah, yeah. So I know it's each one of us has to find our own ways in our families to understand this process and make our own systems accordingly. Yeah. Next question is Kamla Ghosh, 31-year-old. I have a 3 month old baby, and this is his first winter. How do I protect my baby from cold, flu, or any other related problems?
Yeah, so this is one thing which I also wanted to tell. Keeping a baby warm is very, very important, because when the baby is not kept warm, his entire calorie will be spent in keeping himself warm, and there will be no adequate weight gain. So please make sure your baby is kept warm. You can swaddle the child, you can apply some socks or anything, and you can gently check for the body temperature. You can keep your palm and check for his temperature in your chest or abdomen, and make sure it is warm. And as far as cold and flu is concerned, it is mostly infectious. So avoid taking your baby out to crowded places, and don't let lot of visitors to visit the child. Even if they visit, don't let them touch the baby over the face, kiss them, be very close to them. So all this will prevent them from getting infection.
Yes, ma'am. And also, you were talking about vaccine schedule and flu shot schedule, and
Yes,
what is the importance of, with the kind of pandemic that we all have faced and flu being
yes,
rampant, how important is
yes.
this?
Flu shots are very important, especially in monsoon seasons, which is happening right now. So once the baby becomes 6 months, you can start giving your flu shots. The first shot can be given, and the mothers can also be vaccinated for flu, because the mother is the one person who is always in contact with the baby. So mothers can also be vaccinated, and that will help.
Yeah. And now, Kamlaji, because your child is only 3 months old, you've got to wait for the flu shot. Till then, distance is the best way and keep your child warm. Yes. Next question is Anand Chawla, who's 35-year-old, and the child is baby is 2 year, having a lot of pimples like hives on the body, on hands and face. Though they appear on all of the body, they do disappear very quickly. Is it something that they need to bother with?
So the commonest cause of these rashes occurring specifically in the exposed areas, that is the hands, legs, and face, is usually mosquito bite allergies. So babies are very frequently they will get these allergies, which will usually disappear. But in case this happens very often, it is always better to get the child checked by a pediatrician. If it is this, you can just take a picture and then show it to your pediatrician. If it is an allergic reaction, he or she
Ma'am,
they
sorry.
will be
Yeah, sorry, ma'am. There's a continuation to the question which I missed reading. That's the reason why I asked all my participants to type one question in one go. First, they thought that
okay.
these must be the flea bites, but this condition could be it. But these are not flea bites. But I was that this could be allergic reaction. What should I do? But the pimples do disappear after a while.
So allergic reactions can also happen like that. Usually, it will be associated with itching, and usually there will be like large reddish areas, what we call as urticaria. So, in case your child develops reactions like that, it is better to consult a pediatrician and start them on anti-allergic medications.
Okay, ma'am. I am surprised to see that there are, yes, diaper rash questions. I was thinking there are not many, but here's Jaspreet Kaur, 31-year-old. Can I use the powders like Candida or anything like Closip dusting powders to help my baby to help get my baby free of diaper rash? Is it true that these will prevent diaper rashes in babies and infants?
So these are not routinely given. This antifungal, what they've mentioned, can be given only under the prescription of a pediatrician if required. So normally, you if you are using a diaper, please change the diaper once in 3 hours at least. And before you apply your diaper, make sure the area is dry, pad dry, and you can use liberal amounts of diaper rash cream. So this will act as a barrier and will prevent diaper rash. And any powder for that matter, talcum powder, any powder should be avoided in a baby. Usually we see a lot of mothers putting powder over the face. So please avoid powders, and specifically this powder which you have mentioned is antifungal. So until unless required and or suggested by your pediatrician, you don't have to use it.
Right. Next is Akash Sarkar, 38-year-old. The question is about cloth diapers and the regular diapers, commercially sold diapers. Do babies who wear cloth diapers get more rash than those who use the commercial diapers?
No, it all depends on how often you change it. Please make sure that you change the diapers regularly. Don't let the baby be in a soaked diaper for a long time. And also give diaper free time, plenty of diaper free time for your child to move around. Don't have them fully in diapers. And make sure that groin area is dry before you put the diaper, and apply a lot of diaper rash cream. So that should help you from diaper rashes.
Yeah, and also, ma'am, the toilet training, which is a very, very, very important part of child's growing up age. When should this start off, and when should, as you said, diaper free time? How should one
Yeah.
introduce that and make use of the time for child getting accustomed to the toilet training?
So toilet training begins later, now after 1.5 years of age. So till then, it is. I mean, till the baby is comfortable sitting in a potty and start to express the urge to go. So that starts by 1.5 years, and the baby can be toilet trained beyond that. So until then, when I say diaper free, it is okay to put your newborn without a diaper. You can put them on a cloth nappy or in a towel and let them remain without a diaper for some time.
Yeah, that's nice. And it's always easy to wash, and then in case there's a incident of wetting, you can always change the cloth, and that's easier.
Yeah.
Right. And next is Soumya Saxena, 28-year-old mother. What is a normal sleep pattern for a newborn, and how can I establish a routine? Ma'am, is it possible to establish a routine in newborns?
So actually, till the baby is 1 month of age, the baby will not know night or day. So there is there's no use sleep training an infant till 1 month of age. So the best thing you can do is in the morning you can make the room more brighter. You can let the sunlight come in, and after 1 month of age, you can slowly. I mean, after 2 months of age, you can slowly sleep train. That is when the baby, it's time for bedtime. You can put a soft music, and you can make the room dull and dim, and you can gently put this child on bed. So that is how you train it. But till
Yeah.
1 month, I don't think you need to train your baby to sleep.
ग्रेट सो पुनीता मिश्रा एक बेबी का कितना देर तक सोना नॉर्मल है सो हाउ लॉन्ग कैन अ चाइल्ड स्लीप आई अंडरस्टैंड दैट बेबीज ग्रो इन द स्लीप बट व्हाट इज अ नॉर्मल अमाउंट ऑफ
Yeah.
स्लीपिंग
So a newborn baby can sleep from 14 to 18 hours per day. So it's absolutely normal for a newborn to sleep up to 16 to 18 hours per day. They only wake up for the feeds and for the, I mean, when they are wet. So it's absolutely normal for them to sleep. And after that, when the baby is more than 2 months, they can have a sleeping time. They can sleep up to 4 hours per night, and they usually wake up for the feeds.
Right. So, next question is also a registered user's question. My baby makes a lot of noise while breathing in the sleep during sleeping. Is this normal? Yes, a lot of children do have blocked nose and they do open
Yes.
mouth. And so,
Yes.
how is this understood?
So many babies they have this complaint. So it is usually due to nasal block, and which is you don't have to worry much. So how do you differentiate it from a serious infection? So when there is a noisy breathing along with the difficulty in breathing, so when the baby is breathing fast or there's a deep breath along with this, that means the baby is having some infection. But if the baby is only having noisy breathing, which is due to a blocked nose, usually when you wake up, I mean, put the child on your shoulder erect, or you give some safe saline nasal drops, that can get relieved. So for that, you
Yeah.
don't have to worry much.
Okay, done. And any red flags or warning signs that you would want a new parent to keep a watch on? Any emergencies that can be avoided?
So yeah, so in case the baby has a fever along with it, or as I said, a difficulty in breathing, which can be like a very fast breathing or very deep breathing, or not taking feeds properly, lethargy, or not voiding urine adequately. So these are the four warning signs which you have to take note. In any of this occurs, you immediately reach out to a pediatrician.
Wonderful, ma'am. And probably the last question that I'll take for today's session is Mr. Nitin, male 26, and the baby is 1 year old, born at 960 grams, premature baby at 26 weeks. So I'll repeat the values, ma'am. 26 weeks, premature child, born with 960 grams of birth weight. Now the child is 1 year old. She still vomits when we feed her. What's the solution and why is she still vomiting?
Okay. So when the child is 1 year old now, so it has nothing to do with the prematurity. So usually by 1 year of age, child could be fussy. So if the child is after feeds, if she's just spitting out feeds, it's absolutely normal. But if she's vomiting, then you have to again get your child checked for better. And if it's associated with abdominal distension, then it's always better to have your child checked up by a pediatrician.
Yeah, and I'm just smiling at Gauri Simha's question. 35-year-old, I keep saying last question, but something else pops up. So this probably should be. Newborns, some people say that newborn will get digestion problems if you lay them on their back, but others say not to lay them on the side due to serious risk. Which is a better position of sleeping for babies?
So it is for when you put a baby to sleep, it is always better to put them on their back. So, but there is something which we call tummy time. So tummy time is when you can start it during the first week itself. You can initially start it for like 3 to 5 minutes and slowly increase the time. So you put this should be always supervised. You can put the baby prone in the tummy and can have them supported in their arms, and you have to stay close and interact with the child. So this can relieve the child of any colic, and also the child become very responsive, and it can also help in the getting the achieving the neck control easier. So this
Right,
you can start along with the consultation with your pediatrician. They can exactly help you and tell you when to start it and how to do that. This will
right,
also
ma'am.
help in the bald spots which can appear in your head.
Right.
So this
One
can
last question, ma'am. One last
yeah.
question. Devsmita
Yes.
Das, my baby is 2 month old and sometimes baby refuses to be breastfed or bottle fed. What should I do?
So this is the answer is in the question itself. So when a baby is being breastfed and also being given a bottle, there's something which happens which is called a nipple confusion. So a baby which is exclusively breastfed will know how to suck on a breast. But when he's being given a bottle, the milk flows very easily. So when he's being breastfed again, he will not be very comfortable. So always avoid giving both. So till 6 months of age, it is always safe to give only breastfeeds. And even later, you can start giving on the spoons and there are other palade feeds or something. It's always better to avoid a bottle due to lot of issues, sterilization, all that.
Yes, ma'am. Yes. So with that, I think we come to an end of the entire live session for questions from audience. Now I want you to conclude with some top tips that we can remember easily and refer them always. Top tips to take care of a newborn.
Yes. So a newborn baby brings a lot of joy and happiness to the family. So what I want to reiterate is exclusive breastfeeds till 6 months of age is compulsory for all babies. And along with it, you continue your vitamin D3 drops till 1 year of age. And always the vaccination, which has to be given in the right time. And any other doubts or queries you have, all of pediatricians are available round the clock. So you can consult us anytime. Thank you.
Thank you, Sangeetha ji. You have been an absolute delight and pleasure to talk to. And as always, I believe that your pediatrician should be a friend for your child and as well as you. And Dr. Sangeetha Hariprasath can also be consulted in Apollo 24/7. And Apollo 24/7 as a platform connects you to your physicians without being physically going there for any quick doubt. Thank you, ma'am. Thank you so much for sparing your Sunday morning with us.
Thank you.
Thank you, ma'am. So I think time for our quiz now. Quickly, I'll tell you the rules to participate. Answer the questions on YouTube chat only. Winner's name will be announced towards the end of the show. And if I take your name to be the winner, and you will have to write back with your name, phone number, which also has Apollo 24/7 downloaded, and then other contact details like address and your email ID to marketing@apollo247.com. Gift vouchers will be shared with you, and the winners will be selected at the sole discretion of Apollo 24/7 team. And we want as many people to win the prizes and not the same person winning all the time. So let's see who's going to participate today. Get ready, and here are the questions for your quiz today. Fill in the blanks. Vaccines helped to what? Basically, the word starts with PR blank, T blank, C blank. What's the word? Vaccines helped to dash babies from certain diseases. Question number 2, true or false? Babies are not born with fully developed immune systems. True or false? Question number 3, yes or no? Newborns are able to consume solid foods shortly after birth. Yes or no? I repeat the question number 2. Question number 2, babies are not born with a fully developed immune system. True or false? Question number 3, yes or no? Are newborns able to consume solid foods shortly after birth? These are the questions for today, and I'm waiting for our winners to be announced. In the meanwhile, let me give you the coupons that you can use on Apollo 24/7. Please download Apollo 24/7 app, become a Circle member if possible, because there are a lot of membership benefits that you get. And here's one coupon that you can use, ASKDOC150. The code is AskDoc150. You can consult top doctors direct from Apollo hospitals and get 150 rupees cash back on online doctor consultation. And the next one that we are giving away is code first 3. You can order medicines direct from Apollo, get 25% off on online medicine orders. This is valid on the first 3 medicine orders, which are above 1000 rupees, and you also get a 2-hour delivery window when you order from Apollo 24/7 with other benefits as well. Chaliye, next one that we are giving is exclusively for our Health Hour viewers. Use the code HH247 to get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. This code is in addition to the other codes that we have given away. You can use this if you've been watching Health Hour. Then please use this code to get the additional benefits as well. So next week, by the way, you can also access Apollo 24/7 on WhatsApp. If you're looking for medicines or booking lab tests, they're just a call away. Call or WhatsApp on 9355 Easy number to remember. Save the number to avail healthcare services on your phone, WhatsApp as well. So next week, we are going to talk something interesting. We are going to talk about hormonal imbalances. What are these hormonal imbalances? Could range from your thyroid to PCOD to other metabolic disorders. We are going to talk all of them. What are the signs and treatment options? Do join us next Sunday, 11 a.m. On Apollo 24/7's YouTube or Instagram or even social media like Facebook. This week's winners, I'm going to announce the winners' names: Kanishka, Pradyuman, and Kanupriya. Kanishka, Pradyuman, Kanupriya. You have to write back to us with your name, phone number, email ID, and your address to marketing@apollo247.com and claim your prizes. Thank you all of you for joining us today in the live session, and it was a great pleasure having you all. Namaskar.